Okay, I'd like to call to order this meeting of the first 5 Sacramento Commission for Monday, October 2nd, 2017. Madam Clerk, will you please call the roll and establish a quorum?
Dave Gordon.
Here.
Beth Hassett.
Here.
Terrence Jones.
Here.
Olivia Kassiri. Paul Lake. Scott Moe. Phil Cerna.
Here.
We have a quorum, but with a couple of the members being out, Kathy Kosick will vote for Olivia Kassiri, Terry Porter for Paul Lake, and Christina Elia for Scott Moe.
Okay.
This meeting of the First 5 Sacramento Commission is cablecast live on Metro Cable 14, the Local Government Affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. This meeting is closed caption and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, October 4th, 2017, at 2 p.m. on Channel 14. Members of the audience wishing to address the Commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
Thank you. Please rise and join me in the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, again, I'd like to welcome everyone to today's First 5 Sacramento Commission meeting, and again, invite anyone that wishes to address the Commission on any item on the agenda to please fill out a speaker slip and give it to our clerk. You're also invited to speak on any item that's not on our agenda, and we'll call on you at the appropriate time. We do ask that people keep their comments to 3 minutes so that everyone has a chance to address the commission if they so choose. So with that, our first item, please.
Approve the August 7th, 2017 draft action summaries.
Okay. Any member of the commission have any suggested changes? If not, entertain a motion.
I move to approve.
Second.
Moved by Commissioner Jones, second by Commissioner Hassett. All in favor?
Aye.
Aye. Opposed, abstained, motion carries. Thank you.
Item 2, approve the 2018 commission meeting calendar.
Okay. Any commissioners have any comments, suggested changes? If not, entertain a motion.
So move it.
Second.
Moved by Commissioner Elliott, seconded by Commissioner Jones. All in favor?
Aye.
Opposed, abstained, motion carries. Thank you. Okay, separate matters.
Public comment on non-agenda items.
Okay, again, this is the public's opportunity to address the commission on items not on our agenda. I'm not in possession of any speaker slips, nor do I see anyone approaching the podium, so I will assume no one is interested in doing so this afternoon. We'll move on to the next item, please.
The Executive Director's Report.
Good afternoon, Commissioners.
Good afternoon.
Hope you're all doing well. I have a pretty quick update for you. I'm just going to pick a few of my favorite things to highlight. You have in your packet, handout looks like this, Care, Cope, Connect. This is a collaborative project between Sesame Street and the First 5 Association of California. And its main purpose is to have a fun and interactive way for families to address stressful situations. It came out of discussions about helping with immigration issues and the stress that deportations are causing on families. And you might not know it from looking at it, but in there somewhere there are the resources and connecting families to those. But it could be used for a variety of reasons. It comes in several languages. We are stocking it in English and Spanish, and the rest can be downloaded from the website. So check it out when you get a chance. I wanted to give you a brief update on our implementation planning. As you know, at the last meeting, you all approved our 2018 implementation plan. And you approved us to go ahead and begin working on competitive and non-competitive requests for applications. So I'm happy to say our first request for applications went out to our school district partners last week, and then the rest will sort of slowly roll out over the next couple of weeks. We have quite a few of them to get out the door, but we're excited about them, and we're happy to move into the next phase when we can bring it all back to you after the new year for approval on those contracts. So we're not anticipating any disruption in services. Our Community Connections mini grant program. You may have been hearing us call it Community Building Grants, and we've renamed it Community Connections because it was giving some confusion in the community about could they build things like actual structures and facilities and stuff. So we're going to call it Community Connections mini grants now. Our group of commissioners and advisory members and group leaders met to talk about the future of it moving into 2018, and we had some great ideas come out about working with low-income housing complexes. And so that group gave some great feedback. We're doing a little research, and so in addition to our normal community connections grants with parents, we might actually, after the new year, venture into some partnerships with low-income housing complexes to do work right there where families are living. So we're excited about that, and we'll roll that out and bring that to you as a part of a larger presentation later this year. I have one sustainability project, a success story, and that's with our partner River Delta Unified School District. I've already talked to you about our partnership with Head Start and how that alleviated First 5 having to fund 24 spaces and actually brought 40 spaces onto their campus. And we just had another success with some assistance from the commission and our Monine Mendoza, our planner, really encouraging the school district to apply for California State preschool programs. They were also awarded funding for their Ileton school. And so we no longer have to fund 16 spaces there, and they increased those to 24 spaces. So this is really wonderful work, what we're hoping that more of the school districts would be able to move toward. Not only does it save the commission nearly $160,000, but it also guarantees that those spaces will be there when commission money goes away. And that's the critical thing that we're working on, is ensuring services stay when commission money leaves. So very excited about that partnership and their sustainability efforts. As for a staffing update, we have a new change. One of our long-term employees, Julie Byers, is retiring at the end of the year, and we have worked in partnership with Dr. Cassirier to hire a position that we will both be sharing. They have funding through the Dental Transformation Initiative, and we'll be hiring at 0.75%, and we will use the other 0.25% of a full-time person to work on our dental initiatives moving forward in 2018. So Christina Clinton joined Dr. Cassiri's team today, and on January 1st, she'll join our team as well, housed at First 5 Sacramento offices. So just another way of working together and saving money. Commissioner Kennedy, in his supervisor and commissioner role, had a fun fair on September 20th in South Sacramento, and our tooth truck was there and giving out backpacks, and all kinds of exciting things were happening. And so just to highlight that. And a quick MAW expansion update. As you may remember, about 9 months ago, we came to the commission and asked for some funding to be set aside so that we could explore expanding our MAW revenue. And we actually didn't end up spending any money. We sort of did an internal, well, not much money, internal study to look at scopes of work and job descriptions, and really sort of took a course of over 3 or 4 months to see if we could do something with the contractors as they stand right now. And it was going to be a lot of work and probably only bring in about $80,000. And there's a variety of reasons for that, some of which we're hoping we can work with in the future, and some of which were beyond our control. So what we ended up doing was not moving forward with an expansion for the current year's contracts, but as we negotiate new contracts, look for opportunities during that time after the first of the year when we're doing that work to see if there's a way to build some more MAW language or activities into contracts as we move forward. So we'll bring this back to you and back to the Sustainability Committee as those contract negotiations begin to work out. And the last thing I'll highlight is our SAC Healthy Baby videos. Working with our partner RSE, we've created 4 one-minute videos, one for each trimester of pregnancy and one for bringing baby home. And I wanted to show those videos share those videos with you today. So we are ready to play the video whenever you are back there.
Hello, My name is Ashley, and today I'd like to talk to you about what to expect during your first trimester of pregnancy. The first thing you want to make sure to do is set an appointment with your doctor as soon as you find out that you're pregnant. Your first prenatal exam is usually around 8 weeks and will include a lot of tests and questionnaires to get you on the right track for a healthy pregnancy. Here are a few things you can expect during the exam. A detailed discussion of your past medical history, including the start of your last period to determine your due date, a full physical and pap smear if you have not had one already, a urine test, a blood test, discussion of the do's and don'ts of pregnancy, including foods to avoid and ways to de-stress. Your doctor should also talk to you about screening tests that can check for birth defects. Although these tests are optional, you want to make sure you can get all the information you can. At the end of the visit, you will make your next appointment, which will be 4 weeks later. At that visit, your doctor may be able to hear the baby's heartbeat. It's completely normal to have questions, especially if you're a first-time mom. Don't be afraid to ask your doctor about anything you may be wondering about. They're there for you. What to expect during your second trimester of pregnancy. A majority of your prenatal visits will usually be pretty quick, about 10 to 15 minutes on average. It's important that you use this time to ask your doctors any questions that may have come up in the 4 weeks since your last visit. Your baby's heartbeat can usually be heard around the end of the first trimester. If you haven't heard it yet, don't worry. The doctor will be able to use the Doppler to hear it during this trimester. Your doctor will also administer an ultrasound, like this one. This picture helps to verify your baby's due date, check the size of your baby, and, if you want to know, the sex of your baby. I happen to be pregnant, and it's a boy. You can also expect to have a glucose screening test to check for gestational diabetes. During this test, they will have you go to a lab, drink a sugary medical beverage, then, after an hour, you will have your blood drawn. The results will let you and your doctor know what you should do during your next few months of your pregnancy. If you're starting to feel stressed, there are plenty of local resources to help you. Don't be afraid to reach out. What to expect during your third trimester of pregnancy. During this trimester, you'll begin to see your provider every 2 weeks. Be prepared to give a urine sample at every visit. At this time, make sure to sign up for any birth, child safety, or parenting classes. Local hospitals and community centers offer tons of great classes, such as labor and delivery, breastfeeding, safe sleep, car seat safety, and more. By this time, you should feel your baby kicking a lot. Make sure to take notes of when your baby is most active, since a slowdown in normal activity may be a sign of something wrong. Make sure you discuss signs of labor with your provider as well. You're almost there. Delivery is close, so you need to be prepared with a few things to make sure you're ready for when you go into labor. Pack an overnight bag with your ID, insurance card, a toothbrush, phone charger, your baby's going home outfit, and anything else you may need for an overnight stay. Make sure your car seat is properly installed because you cannot take the baby home without one. Any day now, you're in the home stretch. What to expect once your baby arrives. Whether your labor kicks in naturally, between 37 to 40 weeks, or if the doctors had to step in to induce your labor at 41 to 42 weeks, either way, you made it. There are 2 types of delivery methods, vaginally and cesarean or C-section. Once you deliver, the baby will be placed on your chest for skin-to-skin contact. You will be in the hospital between 1 to 3 days, depending on your delivery method. And then, it's finally time to take your baby home. When you walk out with your new baby, nurses will check your car seat. It's very important that the car seat is installed correctly. Breast milk contains all the nutrients your baby needs to have a healthy start. Prior to leaving the hospital, nurses will help you with different positioning and ways to get your baby to latch. If you need more support, lactation consultants are just a phone call away. Starting from day 1, it's very important to sleep your baby safely. You want to ensure that your baby's alone, on their back, and in their own crib always. Having a baby can be stressful, thrilling, draining, and exciting. Spend time with your baby. Cuddle and bond. But most important, make sure to take care of yourself and reach out for support.
Is there going to be a sequel from birth till about 25?
Well, I think Linda said that Ashley just went out on maternity leave herself, so she's right along there too. So it's something that we've noticed as
almost everybody gets pregnant who works on our cultural broker and awareness campaign. It's just funny. So yeah, it's in the water.
You need the segment on when they become a teenager.
That's exactly what I need. So thank you. That concludes my executive director report.
Commissioner Kenny?
Yeah, you mentioned that we had the Smile Keepers out. I just wanted to say what a huge success it was. There was a lineup the entire day.
Nice.
In fact, we actually have to turn people away, but it was really wonderful. It was very well done.
Great.
Thank you.
Thank you.
Commissioner Wirtz?
Thank you, and thank you for the report. This is a sad day, as we all know, for the gun shootings that occurred in Las Vegas, and I just want to comment that this Care, Cope, and Connect is relevant today as well for our families, and I think it's just important to recognize that, as you said, that you started this investigation looking for ways to deal with the immigrant issue that we have going on as well, and this was created in part out of that starting thinking and so on. And I think it just shows how broad and widespread this issue of our families and children facing trauma, whether it be directly as a participant in the circumstances, or as someone that's watching television and seeing these horrible things happening. So I just want to say thank you for doing that, and I think our families need that at all times. So just wanted to say that. The second thing, just to mention, I think we, in terms of our pregnancy issues, we do talk to families about using the National Teen Talk or Teen Baby website as well. Is that correct? I'm getting the name wrong now for no one else comes immediately to mind what the teen, it's an app that you get and you sign up for, and you get timed responses for your
Text for baby.
Text for baby.
Text for baby.
Excuse me. Thank you.
Yes, we do promote that.
And then finally, there's just one other. The other thing I just wanted to mention about the Community Connections mini grants, we had a very productive meeting around thinking that through, and the low-income housing complex is really an exciting potential. But I just wanted to highlight that we also thought very carefully about how to do that in a way that does not put our families at stress. As you can imagine, rental complexes have issues around rent and problems with the circumstances there. So the relationship between the managers or the owners and the renters are not always stress-free, and that therefore in developing these partnerships, we want to look for low-hanging fruit where we have positive rental association involvement and managers that are aware of and sensitive to those issues, including immigrant issues as well. So.
Perfectly stated. We're taking it slowly because we are very aware of some of those issues between landlords and managers, and we don't want to cause more trauma or stress within those apartment complexes. So we're really looking at just maybe 1 to 3 that we might pilot with that have great relationships, and start there to see how it goes. Thank you.
Commissioner Cossack?
Yes, I know we get this monthly report, but I just wanted to send out kudos to Julie and Aaron for a really excellent job on social media. You do just an excellent job month after month after month. So thank you.
We appreciate that.
All right. Okay, thank you. Next item, please.
Advisory Committee update.
We don't have an update today. Our next meeting will be held on October 13th, and we didn't meet in September.
Okay.
Evaluation Committee update.
Thank you. We have met several times since we've last presented here, and I think the one thing we've been productively working on, for example, the August meeting looked at those issues around the community grants. But the one issue I wanted to bring up is that we are struggling some to get a quorum. And I think David and Christina and I are pretty regular, but we've been having some difficult getting. We're now at what's our total? We're at 4 members, and so therefore we need 3 present at any time to.
You're going to love to hear this then. I just recruited our next advisory committee member to join, and he will join us for our next meeting.
Excellent. Thank you so much. We've been,
it's a hard push.
So our functioning has been that we have still been making, reviewing and making recommendations without it being a formal action. And I think I'm hoping that still helps Carmen and your team to move forward. And we, as always, listen to the applied survey research and LPC's reports and discuss how to move forward on those and give advice for that, as well as for parsimony and so on. So I'll stop with that and see if either David or Christina. All right, so we'll be getting back on track of having formal approved minutes and actions soon.
Very good. Thank you. Next item.
Financial Planning Committee update.
We last met in July. I believe we already gave an update at the last meeting. Our next meeting is this Thursday, and we'll be reviewing the draft audit report.
Very good. Thank you.
Sustainability Committee update.
The Sustainability Committee did not meet in September, and we will be meeting next on October 17th, and we're working on our agenda, and we'll report back at the next meeting.
Okay, very good. Thank you. Next item, please.
Public hearing, review, and adoption of the first 5 Sacramento Commission annual report for fiscal year 2016-17.
We have Carmen Garcia Gomez will handle this one.
Good afternoon, Commissioners. In compliance with the Children and Families Act of 1998, today we present the annual report that will be submitted to First 5 California at the end of this month. The contents of the report consist of 3 sections: the AR1, which highlights the county revenue and expenditure summary, the AR2, which are the county demographic worksheets, and includes 2 compelling outcomes. And finally, the AR3 County Evaluation Summary, which outlines evaluation activities that took place during fiscal year 2016-17. Attachment 2 is the County Highlights, which is the highlights that are included in the First 5 California report, and they're actually printed in the report. And I will talk about those as well. The expenditures for for fiscal year 2016-17 totaled $22.5 million. During the last fiscal year, we provided services to approximately 61,314 parents, children, and providers. And the number of client-level data records that we have in Persimmon are 24,038 individuals. The table on page 2 of your commission letter highlight the ethnicity of parents and children and the primary language spoken. I do have something to share, is that the Latino population that we served this year went down by 3%, and I suspect that a lot of our Latino families aren't reaching out for services because of what's going on with the whole immigration issue.
Can I interject here?
Sure.
What are we doing to proactively address that?
We talk to our partners. Our partners are very active in ensuring the population that we are safe. Our partners are a safe place to come out and reach out and provide services. There was a time that they were very afraid to even leave their house to take the kids to school or go grocery shopping. I honestly think it's getting better. I don't think that the fear is as great as it was, say, in the spring.
Are any other First Fives around the state being very aggressive in terms of using their own websites or social media to generally remind Spanish-speaking immigrant families that they, regardless of what service provider or service is being provided through First Five, that they really need to make sure they don't stay in the shadows when it comes to health, welfare of their families and their children?
I don't know what other commissions are doing.
It's something that we've addressed at our First Five Association meeting, so it's happening statewide. It's not just a Sacramento issue. It was, as I said, sort of the impetus behind Care Connect and Care Cope and Connect. And we all kind of do very similar things, which is talk about First Five services are for all children, regardless of documentation, and provide information through social media and through our websites that continues to encourage parents to bring their kids in for services.
Can I make a suggestion?
Sure.
That on our, and I'm kind of looking at Aaron, that maybe on our website, the first thing you see, maybe have a box on the right or something, or a scroll or something that's in Spanish and English, at least, and explain. It's kind of a stop, look here. If please, don't reconsider availing yourself and your families of services. Something that catches their attention immediately, so that they don't have to get to 3 pages deep into something, whether maybe they're very ambivalent by that point to even consider searching for whatever it is they need. But I think having that bold message right at the front of the page is something we ought to be doing.
Sure.
Commissioner Wirtz?
Yes, if I can just speak to that as well. Unfortunately, I think we have to be very careful about that, because what we thought was a protected circumstances is not necessarily that. We haven't necessarily seen action in Sacramento, but we've seen it throughout California that there are serious and situations in which ICE and others are picking people up in places where you would think they would be safe. So one thing I would suggest, if we're going to do that, is Sacramento Immigration Coalition has a hotline for families that are either in need of information or are experiencing danger of an ICE approach. And there's so many things. We've been training people on their legal rights and how to handle the difference between a civil warrant and a criminal one. A civil warrant has no standing, but is often presented as if it does. And so there's a lot of fear and a lot of misinformation. And so one suggestion is that hotline for the Sacramento Immigration Coalition. And it's unfortunate that it is not always safe for people to seek service at a library, at a public facility, and they could be at risk.
I'd have you consult with our attorney on that. But my point is a little different than yours, Commissioner Wirtz, is that regardless of the perceived or real threat of ICE intervention, which I get, we've all heard the unfortunate anecdotes recently. We should do everything we can, though, to ensure people, don't ignore the resource that First Five is, just because they may think that it's somehow going to compromise their immigration status immediately. That's the last thing we want. So I think, again, having something that, at least through our web portal, that attempts to do that and get people's attention in that manner right away is worthwhile.
Thanks. We'll look into that.
Commissioner Elliott?
I just had a question about logistics. So, I agree with everything that was just said, but we've done a lot of work on the intake form that people fill out. That is optional. I just want to validate that they don't have to report anything that would have to be reported to ICE, right? So hopefully they feel safe through that process as well.
We don't collect any addresses on our intake form.
Right.
And we did bring the ACLU to our contractor meeting in the spring to talk to our contractors and encourage them to seek out training on how to work with this population. So that's been...
And then I was also going to say maybe county council could help see, like with verbiage.
Okay. Also part of the AR2 are the compelling outcomes. And this year, we're highlighting 2 programs. The first program that we've highlighted is the Cultural Broker Program, specific to maternal and child health. During fiscal year 2017, there were 239 births. 86% of the babies were born at healthy weight and born full term. When comparing rates of low birth weight and preterm births for cultural broker participants and the county as a whole, the cultural broker participants' rates were lower. The second finding is in the area.
Can you just clarify what you mean by lower, namely better?
Better.
Better.
Yeah.
Yes, better. I'm sorry. Our second finding is in the area of preschool programs for 3 and 4-year-olds. And this is focusing on the incoming kindergartners in the fall of 2016. Those children were more likely to be ready for school if they had participated in any First 5 service prior to kindergarten, but particularly if they had attended preschool supported directly by First 5 Sacramento. 47% of the children who attended preschool supported by First 5 school readiness services were fully ready for kindergarten, as compared to 26% of children who did not attend preschool. The AR3 report, again, as I mentioned earlier, that provides a summary of all of our evaluation efforts during the fiscal year 16-17. And you will see additional information in late winter, early next year, when we come to you with our community report. And finally, attachment number 2, as I mentioned, this is the document that goes to First 5 California, and they include this in their printed annual report. And so it's actually the last page of that item. And in this area this year, we highlighted the efforts of the Commission around system sustainability and the outcomes for the 2 areas that I just reported on AR2. Again, this information will be included in First 5 California's printed annual report, and you will see it next spring. That concludes my report.
Thank you. Commissioner Wirtz?
Thank you, Commissioner Cerna. This is something that obviously our evaluation committee looks at and provides ongoing feedback around. And so I think it's really important to sort of re-emphasize what Carmen said, that these are compelling outcomes, that these are in fact not due to chance. We can basically rule out chance, that these are significant findings, that low birth weight specifically was statistically less of our cultural broker families had low birth weight, and that compared to the broader population. And I think we need to highlight that, and I think we've highlighted the school readiness piece multiple times of demonstrating a consistent over the years improvement from being involved in First 5 school readiness programs. There's a minor discrepancy between attachment 1 in the handout and the report here about 47% of children who attended preschools compared to 26. In the attachment 1, not page numbered, but in the attachment it says 45 and 24.
Oh, thank you. I will make that change.
A minor
okay.
thing. Thank you.
Okay, any other questions, comments? Okay. All right, so we're going to do a roll call vote on this.
There needs to be a public hearing first, and there's no speakers, then a roll call vote, yes.
All right, open the public hearing. Anyone here to speak on this item? Okay, I don't see anyone. Close the public hearing, bring it back for deliberation and vote. Is there a motion?
So moved.
Moved by Commissioner Hassett.
Second.
Second by Commissioner Gordon. Roll call vote, please.
Dave Gordon.
Aye.
Beth Hassett.
Aye.
Terrence Jones. Kathy Kossick.
Aye.
Terry Porter.
Aye.
Christina Elliott.
Aye.
Phil Cerna.
Aye.
Motion passed.
Very good, thank you. Thank you, Carmen, great work.
The presentation, Trauma-Informed Approaches for Funders.
Great. Usually I don't put together a commission letter for you when we're just having a presentation, but this is such compelling and good background information that I wanted to throw some of that into a commission letter for you. So it might be more than you wanted in your commission letter, but provided a nice background. And the context for all of this is that your commission staff and your funded partners are really have been working on this over the past year and continue to work on becoming more trauma-informed and helping our agencies become more trauma-informed. And so we are fortunate today to have two presenters, two locals here. Gail Kennedy is the Director of Programs at ACES Connection Network, which is a nonprofit that connects communities to prevent adverse childhood experiences, to heal trauma, and build resilience. She has a master's degree in public health with 30 years of experience. And as the Director of Programs, she creates tools, resources, and programming to support families. She's affiliated with UC Davis's Institute for Population Health Improvement and serves on the steering group of the California Essentials for Childhood, which I believe Commissioner Wirtz also sits on, and is the California Campaign to Counter Childhood Adversity. And let me get Imani too while he's up there. Imani Lucas is a program director at the Health Education Council, where he oversees the Sacramento Minority Youth Violence Prevention Collective. Imani joined the Health Education Council in 2015 after 5 years as a program director for after-school programs at Roberts Family Development Center. He also manages a grant for the City of Sacramento to run a youth mentorship program for at-risk youth exposed to trauma. Imani currently serves on the steering committees for Resilient Sacramento, the Alliance for Boys and Men of Color, and Unity Circle. So welcome and thank you for being here today.
Thank you.
Thank you, Julie. And thank you, Commission. Thank you for letting us, giving us an opportunity to speak. I just want to say a little bit about how we're going to do this today. Yeah, we've got our slides. I'll be discussing a few key concepts about what it means to be a trauma-informed organization and some suggestions for becoming a trauma-informed funder, and how the science of adverse childhood experiences, or ACEs, fits into these concepts. And then Imani will be sharing some examples from Sacramento County. So we aren't going to go into detail today. We tried to keep this presentation short and sweet. We're not going to go into detail about anything, but you've got a wealth here in the region. You have a wealth of experts, of speakers, of trainers. Actually, there's an expert right here in the room with Carolyn Curtis. So, and we're happy to help you with any resources that you need. So David Sanders, who's the Executive Vice President of Systems Improvement for the KC Family Programs, which funds programs, was recently at a national conference, and he stated, government intervention can cause trauma. Sanders shared that 1 in 4 kids in California would be involved in child welfare, and that the system, by design, does not respond effectively to address the impacts of what we know, the impacts of toxic stress on children's brains. Systems failure can affect the health and well-being of a child through growth and development and across their lifespan. Systems of trauma live in individuals as well as our workforce and the leadership of our organizations and even in our funding streams. Ultimately, what we're talking about is moving organizations and systems from being trauma-organized to creating a trauma-informed culture within organizations. Unfortunately, we know organizations that are trauma-organized. Staff are reactive, crisis-driven, fragmented with an us versus them attitude and perspective. Staff experience high burnout rates, high turnover, suffer from vicarious and secondary trauma, and compassion fatigue. But by developing a trauma-informed organizational culture, we believe that you improve morale and employee retention, increase staff accountability, improve collaboration. You create a safe space where staff are key decision makers that influence their own lives and the welfare of their constituents. We can create a compassionate, caring, healing organizations for both staff and the clients they serve. So we're talking about a shift in community and organizational culture. So it's not a short, simple process. This takes years to achieve, but results are starting to happen. We're seeing in Washington State, where they've been at this for over 10 years, they're seeing incredible, drastic decreases in teen pregnancy, infant mortality, teen suicides and attempts, youth arrests, and high school dropout rates. So first, let me quickly define the 5 components, the way we describe it, the 5 components of ACEs science, and I always put my hand up like the slide. So first is the epidemiology of childhood adversity. So that's how many people experience different types of childhood trauma, to what degree, and what happens as a result. This includes the original ACE study from Kaiser Permanente and CDC, as well as subsequent ACE surveys, which have added additional measures of childhood adversity. ACEs science also includes the impact of toxic stress resulting from these childhood experiences and how it damages children's developing brains, how it affects our short-term and long-term health, and how we pass this toxic stress, and therefore ACEs, from generation to generation in our genes, which we're learning about through the study of epigenetics. And finally, and in my mind most importantly, ACEs science includes resilience research, which demonstrates that our brains, our plastic, and our bodies can and want to heal. So all roads lead to resilience, which is resilience is a person's capacity to overcome adversity and move forward. We know a lot about how to increase individual resilience and how to build resilient families, but you can't have resilient families without healthy organizations, healthy systems, and healthy communities. The frontier of resilience research lies in creating organizations, systems, and communities that prevent childhood adversity and stop traumatizing already traumatized people. So what do we know about ACEs in Sacramento County? I'm not going to talk about this messy slide. What I'm going to do is just highlight and let you know that we do have ACEs data, ACEs and resilience data available for Sacramento County. It's a county data dashboard that is a product of Essentials for Childhood initiative, and using data from kidsdata.org. Lots of folks know kids data. So we know that almost 1 in 4 Sacramento County children were reported by parents to have experienced 2 or more adverse experiences. More than 25% of pregnant women reported experiencing 2 or more childhood adversities. And nearly 20% of Sacramento County adults in households with children reported having been exposed to 4 or more adverse childhood experiences. So what can we do? First of all, I just want to define what we mean by trauma-informed, and it's not we, it's actually the Substance Abuse and Mental Health Agency, or SAMHSA, which is recognized as the lead federal agency setting the agenda for trauma-informed approaches. SAMHSA defines a trauma-informed program, organization, or system as one that realizes the widespread impact of trauma and understands potential paths of recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with systems, responds by fully integrating knowledge about trauma into policies, procedures, and practices, seeks to actively resist re-traumatization, and I would add an additional bullet, and that is realizes the impacts of racial disparities and historical trauma in our communities. At its core, trauma-informed practice asks individuals what happened to you rather than what's wrong with you. And for organizations and systems, it looks at what has happened to the organization or the system and how can we help heal it, rather than what's wrong with this organization. Just wanted to mention that the San Francisco Department of Public Health, a workforce of 9,000 employees, has begun integrating trauma-informed practices across their workforce, educating everybody about trauma and the effects of trauma. Just a note, Dr. Kenneth Epstein, the lead of the initiative, said in a presentation that he did recently, when you start talking about trauma-informed practices, you're going to expect 20% are going to be early adopters, 20% are going to be gung-ho, this is great. 60%, well, they'll participate and they'll come along, and then there are going to be 20% that are resistant to it and think that it's not something they want to be involved with. So it's important to think about how to address that last 20% and make sure that they don't absorb the energy of the movement and, detract from the energy of the movement. So what do we mean by being a trauma-informed funder for First Five? What I did, so this, you'll see these principles, the third bullet down. These are SAMHSA principles for becoming a trauma-informed organization. And I also added in Sandra Bloom, who's one of the front runners, leaders on trauma-informed practices from Sanctuary Model, articulates principles as well. So I sort of blended them. But we're talking about safety through building a culture of nonviolence. We're talking about trustworthiness and transparency through building a culture of emotional, intelligent, and open communication. Peer support and mutual self-help through culture of inquiry and social learning. Collaboration and mutuality through a culture of shared governance. Empowerment, voice, and choice through a culture of growth and change, restoring hope, meaning, and purpose. And finally, cultural, historical, and gender issues through a culture of social responsibility, rebuilding social connections, and establishing healthy relationships. So with those principles in mind, here are some suggestions of ways that Sacramento First Five can become a trauma-informed funder. So first of all, raise awareness, educate about ACEs science within First Five, with the commission, and with the larger community. And that's happening. We know that's happening, and I would say that's fabulous, and you'll hear some about the ways in which the community as a whole is doing that. Another way, create a trauma-informed culture in the daily work of First Five. Leadership, throw your support behind this and help First Five Sacramento become a model for the community, creating a trauma-informed culture here in Sacramento and actually become a model for the state amongst First Fives. Another thing that First Five can do is consider ways to integrate trauma-informed practices, principles, and policies into your grant-making process. So engage grantees and community organizations for suggestions, recommendations, ideas about a grant-making process that encourages collaboration over competition and breeds compassion and infuses kindness and empathy. For organizational staff and the communities that they serve. So these are just some of our suggestions, but I do think engage the community and they'll have much better ones than this. But just simplifying, thinking about the grant submission process as simple as possible, thinking about deliverables and reporting requirements. Consider the complexity, the frequency, the timing of submissions, and the reporting requirements expected. Most community organizations have a small staff that do many things, so a grant submission is oftentimes on top of the programming that they're doing and they're asking their staff to do. So if you set a grant submission due date with a tight turnaround or after the holidays, you know that organizational staff will be working on it during the weekends or over the holidays. Establish open, transparent communication with grantees and build strong partner relationships. It's important to communicate about things like ebbs and flows of funding, especially communicate about possible funding cuts as soon as possible. The stress of not knowing if funding will be coming creates a trauma-organized organization. Consider innovative ways to foster collaboration and break down silos and competition among community organizations. Consider innovative collaborative grants that encourage community partners to work together. Create opportunities for networking where they can learn from each other and foster collaboration. Encourage non-traditional partnerships and seek innovative strategies to build community resilience. You'll hear about Resilient Sacramento, which is attempting to do that. You'll hear that from Imani. Bring grantees together around topics of shared interest amongst organizations. In San Francisco at the Department of Public Health, after initial education about ACEs science, they polled organizations and identified common themes that emerged and created cross-organizational trainings. In San Francisco, the most important issue was race. So they're offering trainings on race and historical trauma. First Five Sacramento could support grantees to integrate trauma-informed practices, principles, and policies into their programs. So encourage organizational leaders to commit to creating trauma-informed organizations. Make it easy for them. Provide support, resources, technical assistance, and training to assist grantees with this. And finally, it's important to track the continuum of change within organizations and across the communities. We want to see what's happening. So to that end, we at ACES Connection Network have developed a free tool for communities to track organizational progress towards becoming trauma-informed. After examining a plethora of trauma-informed assessment tools, we chose these 11 milestones that are common to most, if not all, organizations across sectors. So the milestones include leadership commitment, which we know is very important, ACES science, awareness, and education for all staff, implementation of trauma-informed practices with staff and clients, safe physical environment for staff and clients, clients educated about ACEs and resilience, engagement in collaborative efforts across the community, and ongoing evaluation of the efforts. So this tracker doesn't evaluate how well an organization is doing at each milestones, but we believe that if organizations are completing these milestones, there's a pretty good chance that there's real change that they'll be seeing. So I'm going to now turn it over to Imani, who's going to talk about what's happening in Sacramento.
Good afternoon, committee. My name is Imani Lucas. I'm with Health Education Council. We've been a member of Resilient Sacramento on their steering committee for going on our third year now, and it's just been an honor to be a part of this trauma-informed movement as part of ACES Connection and being part of the steering committee. For Health Education Council, I've been asked to come up here to talk a little bit about some of the examples that organizations are doing, and I'll start with our own. HEC has a 25-year history of providing access, advocacy, education, and training to empower all people towards a healthy life. So some of our trauma-informed work happened before it became a buzzword, and people started talking about it and referring to it as such. We organize our programs really to focus on areas such as tobacco prevention, obesity prevention, but then just recently we've started working with our Mexican consulate and providing mental health services, as well as our violence prevention arm, which we call our Safe Neighborhoods arm of Health Education Council. We do some violence prevention work along with other works like our walking groups, which brings community together. Some of our family nights, our family skate nights, which also brings community together. So, whereas health education began really trying to fight issues related to obesity and other preventable diseases, it took some of our ACEs science to really kind of form our journey into becoming trauma-informed. So one of the intriguing things that we started off, and as you look at the slide here with the basic chart of ACEs, one of the intriguing things was that this study started off as an obesity study, which was right up our alley because of obesity prevention and our tobacco prevention efforts. So what Drs. Folletti and Anda did is they created this wonderful survey, and surveying 20,000 people around those general ACEs that you see in the inner wheel. some of the emotional, sexual trauma that young people face along the way. But then over time, doctors started to research even further and account for some of the things that are happening in our at-risk communities. So for the example of HCC, we started off by doing our education for obesity prevention and trying to encourage more people to eat healthier and get more exercise. But we found that it was difficult to try to encourage those people to do some of those things when their basic needs haven't really been met. So it's hard to try to enforce exercise outside and being a part of your park when you're worried about your neighborhood safety. It's difficult to think about eating healthy and making that a common practice when you're dealing with issues when you go to your healthcare provider, or you're dealing with everyday issues of racism. When those things are on your mind, it's very difficult not to just go and try to take in food no matter what it is, right? As long as it tastes good, you get it in, you get it out. That is not your main concern. So, for Trauma Informed, for Health Education Council, Trauma Informed meant kind of changing that culture and changing that scope, not to just focus on those prevalent issues like the obesity piece and the tobacco prevention piece, but then understanding its social determinants. So we really changed our focus in our culture to talk about those social determinants more, and in particular, we emphasize more of a culture of community, social connection, parental support, financial literacy, education, overall safety of neighborhoods, and then system change advocacy for organizations that serve youth and young parents. So I believe I heard Commissioner Wirtz talking about, he mentioned 3 words that made me open up my eyes a little bit more, and it was care, cope, and connect. And I think those are really 3 terms that would describe how we would like our Sacramento First 5 Commission to consider funding initiatives and organizations. So basically, and I know we're kind of on some time constraints, so I'll try to be brief. Resilient Sacramento as an organization, along with Health Education Council, sees system change necessary at 2 basic levels. We talk about the institutional level. For trauma-informed funders, we like them to consider funding initiatives that promote awareness and provide training in trauma-informed practices to our local public sector institutions. Because that greater awareness of trauma helps the staff identify particular issues in their client base, minimize the re-traumatization of folks who are already coming in traumatized, and then to provide more appropriate care and overall communication to their clients. Some of those examples include our healthcare system, our law enforcement system, social services, our education system, and of course, our correction system as well. Some of these institutions have made some strides in becoming more trauma-informed, but there's always opportunity to learn more, and as Gail mentioned, get that last 20% to really buy into the trauma-informed structure and what we're trying to move forward towards. And then it's equally important for this awareness and training to be funded and provided at the community level to help children and young parents dealing with trauma. Or past diversity from childhood, cope with issues, better communicate with caregivers, and develop a stronger support and social systems. So that's why it's also important, not only on the institutional level, but the community level, so that those families of the young parents and youth are better able to understand their own trauma, so that when they're coming in to communicate with some of these institutions, there's a way that those folks can meet halfway and really help each other out moving forward. And it's also important for families to gain that type of education so they can start practicing those self-care issues to prevent from even having to go to some of those healthcare institutions because of preventable disease. Okay. All right, so we would also like to fund, and I believe Gail mentioned this as well, we also recommend that funders consider support for multi-sector collaboration around trauma education and ACEs awareness. Collaboratives like ACEs Connection and Resilient Sacramento represent several different business sectors and a wide range of ideas and strategies to add to this movement. It's necessary to cultivate these types of collaborations so that systems can share best practices and reach youth and young parents and promote well-being by meeting healthcare needs from several different angles. So now I wanted to go into some of the examples that we've had from some of our members. I have to kind of read carefully for some of the programs here. I wanted to give you guys an example of a early childhood example, but also an example that we've used with high school students and young adults as well. So I'll start with Family Hui. Family Hui's mission is to support, encourage, and empower families to meet the challenges of raising young children by celebrating the joys and coping with stresses in healthy ways. Their services include a 12-week mindful parenting neighborhood peer groups with trained facilitators, a mindful parenting participant notebook that could be used with some of those groups, developmental screening using the Ages and Stages questionnaire and the Ages and Stages social emotional screen, resources and referrals and materials, an ACEs informed resilience focused design, and a community of support. So Family Hui emphasizes the importance of parenting and creating nurturing, safe conditions for raising young children. The age range of Family Hui's target population is birth to 5 years, and they currently are active in California, Hawaii, and Eastern Africa. Family Hui peer-led groups discuss positive parenting principles and empower parents and caregivers while promoting healthy child development. Family Hui also knows that positive parenting calls for an abundance of love, empathy, and respect, consistent guidance, and positive discipline when raising young children. And that's why their curriculum educates parents and caregivers about the consequences of adverse childhood experiences and trauma, more generally, and assists parents in building resilience in their own lives and the lives of their children. We also have a group that's working with Health Professions High School. And with Health Professions High School in Oak Park, they've adopted the Mind Matters, Overcoming Adversity and Building Resilience curriculum for their students. And what was interesting that they gave the ACEs survey to several of their students. The score with 100 students, 10% of them only had 0 ACEs, 45% had 4 or more, and then 12% had 7 or more ACEs. So this is right in the heart of Oak Park. As some of you know, there has been some violence that has happened historically in that area, and just recently, maybe about 2 or 3 weeks ago, there was another shooting where some young people were murdered. It's unfortunate but not surprising that the level of ACEs that come from the students in that area is so staggering. But moving on to, we have another partner that works on a play called Trigger. And I don't know how many of you had actually witnessed this play, but it was a great play that really focused on adverse childhood experiences. D'Angelo Mack, the writer and producer / director of this play, just did everything in taking that knowledge that we got from our Resilient Sacramento meetings and really pulling it into that 1.5 to 2 hour play that really focused on, that really took it home about ACEs. They looked at ACEs from the perspective of 5 teenage youth, and then their trauma-informed psychiatrist that was guiding them through some of those issues. And the play gave youth and adults additional insight of adversity in children caused by some particular ACEs like abandonment, emotional abuse, gun violence, chronic illness, and anxiety. Lastly, I want to talk a little bit about our SHOP program. And SHOP stands for the Safety, Health, Opportunities, and Practice. It originated in Juvenile Hall in the youth detention facility to where we started trying to address folks that were affiliated in gangs. The residents there, some of them are from rival gang areas, and they've had a history of creating ruckus and creating fights inside of the youth detention facility, causing officers to engage in use of force while they're there at the facility. After the SHOP program, we engaged a counselor to work with 30 youth every week. But then he also does small group sessions and one-on-one sessions with incoming residents from the facility. So what we found is that after engaging some of these youth, some of them from rival gangs, rival neighborhoods, we realized that if these kids can sit in a group together and have conversation, and the conversations focus on conflict resolution, management styles, and alternatives to physical conflict, they were able to get along in those settings. They're able to get along in playing sports like basketball at the facility. Why not carry that on to when after their release, try to continue that practice of having young folks communicate better with one another. So it started off as kids going into there and getting a haircut as a barbershop setting, and that's how we come up with the acronym SHOP, Safety, Health, Opportunities, and Practice, and we've been able to engage over 449 youth so far, and since July 2016, use of force incidents have dropped by 54% in the hall as a result of that. So we're very proud of that, but this is another example of the trauma-informed work that we've been engaging not only with Resilient Sacramento, but the probation department, who's also changed their culture to become more trauma-informed. So we're very proud of those things that are happening. Okay. I had our work with Walk with Friends that was out there too, and I posted a couple of pictures here. As you can see, these are some of the youth that were part of our SHOP summer program. Not only do we do the SHOP at the youth detention facility, we've decided to take that curriculum and work with youth outside of the facility. So right now we operate at Encina High School in the Arden area, and we operate at Samuel Jackman Middle School. So at the middle school and high school level, they're receiving some of this education, understanding more about their conflict styles, but then understanding more about ACEs and being trauma-informed and being a part of your community, which is very important. Our Walk with Friends group, as I mentioned earlier, brings families together in another effort to create this family connection and social cohesion. We look at it as a violence prevention tool as well, because the more people that you have occupying your parks, occupying your neighborhoods during the day, the less opportunity it is to get away with crimes or to engage in violence in those particular areas. We talked about trigger. The last thing I want to talk about is our multi-sector collaboration. None of this would have been possible without the several organizations that get involved and share ideas. So the last thing I really want to encourage the Commission to consider is to keep supporting organizations that foster this idea of multiple sectors coming together to share ideas and create a collective impact. I think it's been very effective with our Sacramento Minority Youth Violence Prevention Initiative. It's been very effective with ACES Connection and Resilient Sacramento, who is not only in Sacramento County, but Yolo County, and just beginning in Placer County. The momentum is real and it's growing. And then other organizations like it. I understand the RAACD, turning the Black Child Legacy, which many of you have been responsible for. Those types of initiatives and collaborations, I believe, are important if we're going to engage in a trauma-informed culture shift. And that concludes it. So,
thank you for a very thorough, complete education, quite frankly, on the subject. We do have one commissioner that's punched in, Commissioner Elliott.
Just something, excuse me, that resonated with me when you guys were first starting the presentation is the trauma-informed organizations. And my brain went immediately to working as if this isn't enough work for you guys. So I don't mean to say that this is something that you could do immediately, but potentially in the future working with local chambers of commerce so that local businesses where our clients are employed could start putting into practice some of these trauma-informed methodologies and policies. And I think that, you know, and like you mentioned, Amani, the stress related to, you know, financial awareness and financial literacy and all of that, and ties to their job and their ability to go to work. We spend most of our day at work, and so being able to impact that, being a positive trauma-informed space would be wonderful for our families. But again, you know, just hearing all this work that you're doing, I don't anticipate that that's something you can get on right away, but maybe in the future.
Absolutely. Thank you, Commissioner.
And actually, we do have business, representatives of business, South Sac, Mac Road, comes to Resilient Sacramento.
Yes.
So.
Yes.
And I was even thinking Cal HR. I mean, start to influence policies at the state level too, and make our state agencies that provide these services trauma-informed. I mean, I think that, again, we're in Sacramento. Our lawmakers, their staff live here for the most part, and they influence policy at a state level. So getting this message across many different levels of government would be really helpful to Sacramento people.
I'm looking at Steve Wertz because there is a movement at the state to move towards we're calling it a program through Essentials for Childhood to move towards helping California become a trauma-informed state. And
thank you for your presentation.
Yes, thank you as well.
Commissioner Hassett.
I'm curious how this fits in with any plans that we have for First Five, and also as somebody who leads an organization where there's lots of trauma, I'm wondering if you have resources that you might share with us so we can go a little deeper with all of this and better understand what you're talking about.
Yes, I mean, should we start with ACES Connection and ACES Too High, which are the main information arms of our group? ACES Connection runs a website, and I believe it's national.
Yeah,
is that right?
It's actually international.
Yes, and to where people can come in, and it provides some daily emails that you'll receive to learn more about ACES as you go along. ACES Too High is another arm. You want to explain that?
Yeah, so ACES Too High is a website. It's kind of a traditional website that is education for the general public about ACES and all things, ACES science, all things. And then ACES Connection really is a social networking site. So I describe it, it's not correct, but the Facebook of the ACES movement. So it's a way to connect with people and organizations across the country, across the world that are doing similar things. And we're organized, we have little communities that are organized. So Resilient Sacramento is the Sacramento's site on ACES Connection. And we also are organized around, so those are geographic organizations. We're also organized around topic areas. So ACES in pediatrics, ACES we have a First Five site. We have, so it's places where people can come where they find their community. And the idea is to share resources and not have to recreate the wheel. So, and then also we do have a list of trainers, and as I said at the very beginning, there's a wealth of information right here. California is a hotbed for this, which is exciting. Between the Bay Area and this region, the Sacramento region, there's lots of experts. So we'd be happy to help you.
Great.
This is also an opportune time to talk about our monthly standing meeting, ACES Connection, which meets the second Tuesday of every month. We meet at the Kiwanis Family Center off of 50th and Broadway.
Yes, right by UC Davis.
Right by UC Davis Medical Center. We meet for roughly 2 hours. ours. This month we have Assemblyman McCarthy coming out to speak to us and addressing some of the issues he's come across in trauma-informed education. We're going to get the opportunity to ask him plenty of questions as well. But that's a standing invitation to everyone in this room. ACES Connection, second Tuesday of the month.
Resilient Sacramento.
Yes.
Thank you. Commissioner Sneeringer?
I just wanted to add, in looking at what our commission can do and how this applies to the birth to 5 population, one area that I've been involved in is the development of a foster care child care bridge program statewide, and a component of that is trauma-informed care training for child care providers to start to build institutional capacity, and that funding is going to start being distributed statewide in January, and Sacramento County has an opportunity to be a part of that. And as that rolls out, there could be opportunities for the commission to partner with those efforts. And once materials are developed, it seems that it would be important to try to use the same messages. And if you start thinking about training child care providers, they're part of your institutional capacity in an ongoing way. So the more informed they are, the more they inform the parents in their program, and it starts to build that momentum. So that is an opportunity on the horizon.
Commissioner Wirtz.
Just a very short comment. One, I really appreciate that, Julie, your leadership on bringing the trauma-informed issues to this commission and to the funded partners that we have. I think it's been already, as I think I mentioned before, some leadership across the state to see you building this into our organizational activities. And I really stress the organizational and systems aspect of this as well. And I'd just say that I think there's a lot of potential for sustainability around First 5 programs by partnering and expanding this kind of vision for how we approach our families and children. So it's an ongoing effort. And I just think that you need to be recognized and applauded for this leadership that you've taken, and the commission has taken to do this, and your staff as well. And I think we will see this help change the culture around our organizations and communities here in Sacramento, and it really does fit well with our reducing African American child deaths, for example, that we mobilize communities around a different way to look at our relationships to trauma and to each other. So
Absolutely.
Kudos.
Thank you very much.
Thank you.
We, could you say 2 words or 2 minutes? We, Family Hui, which Imani was describing, is something that we are funding here in Sacramento through our Community Connections grants. So we have 3 Family Huis going on throughout the county. And we did actually get some language that will be written into our contracts around trauma-informed for our providers, and we are building out the next strategic plan in order to make sure that we have some funding and some resources available to provide some training and technical assistance. And just sharing everything that we do here with my colleagues across the state, I think is really important too. So there's First 5 California's annual conference next spring, and talking with Gail about a presentation there or an abstract or something where we talk about our trauma-informed work as we progress. We've sort of just scratched the surface over the last year. There's a lot still to do, but I do think we're on a good track right now.
Great. Thanks again.
Yes, sir. Thank you.
Okay. All right. I've been informed that we do have a member of the public that was not here earlier that wishes to address the commission on items not on the agenda. Jeanette?
Good afternoon, Commissioners. My name is Jeanette Newman-Velez, and I'm the Breastfeeding Promotion Coordinator at Community Resource Project, which is one of 2 contractors for the Community Lactation Assistance Program. And I'm sorry I wasn't here earlier, but I wanted to let you know about 2 events that are happening that I do believe impact and address many of the concerns that our commission is trying to address, one of them being African American infant death. On October 31st, we will be having a half-day conference with 2 speakers. The name of the conference is Reducing African American Infant Mortality Through Breastfeeding, a Cultural and Legacy Perspective. That's going to be taking place at the Sierra Health Foundation. We received some very generous sponsorship from Sierra Health Foundation and also Dr. Stephanie Walton from Walton Pediatrics, as well as some other individuals. And we'll be working along through our Breastfeeding Coalition and through some of the partners like our Black Infant Health of Sacramento County to make this available for free. I would encourage the commissioners to consider coming, but I think we've sent it to, we've sent it to Linda, and hopefully they can send you the updated flyer to share it among interested parties. But we're really excited because the 2 speakers address the issue about how breastfeeding does impact working specifically with African Americans and how to change that. One of the speakers is Kimberly Seals Allers, who's an author of a book specifically addressing this issue called The Big Letdown, talking about how more should be done to use breastfeeding to help turn the tide with African American babies. The other thing I wanted to bring to your attention, the other presentation is happening, it's more specifically for healthcare providers, doctors, dentists, and it deals with the impact of tongue tie on breastfeeding. Tongue tie not only affects speech and can be an issue later on, but we want, in this particular issue, we're trying to address the breastfeeding. More and more mothers want to breastfeed, but if they have a family history and pass that tongue tie down to their baby, it's very difficult and can cause challenges. Mothers sometimes think, oh, it's my fault, I don't have enough milk, but actually it could be just an anatomical issue that can be resolved. So we are bringing Dr. Gahary here from Oregon to speak on this issue. And again, I can pass that information on to be sent to you electronically. Thank you so much.
Very good, thank you. Okay, item 11, commission member comments. Any commissioners have any matter they'd like to bring up? Okay, if not, we have the balance of our agenda is just communications filed, but as Commissioner Wirtz made a brief reference to earlier in the meeting, today is a very sad day for a lot of reasons. We had the shooting in Las Vegas last night, and so I think it's appropriate that the conclusion of this meeting today that we adjourn in the memory of the victims of the shooting. So if there's no further business before this commission, we will do so.